Okay, so then just go entire face. Okay. And then I'll start taking radiographs. Okay, so let's start with that first.
It is okay.
Okay.
It just,
How
I
is your
used my
system?
previous use that not pretty good.
Okay. Okay, shooting.
Sweet, so close.
So how do you do it?
So, it's all beautiful, it's just if you can slide it back in the mouth a little, get the top of that in the tooth. Or actually, no,
Yeah, no,
anything
shouldn't
at
make
all,
it
let's
wrong.
just turn
Okay,
this a
cool.
little bit more.
Yeah.
Thank you. Yeah, so that way, turn it high, so it's aiming forward, so, there you go.
Like that?
Yep, and that'll help to shadow it for you.
Okay. Okay, shooting.
See how it shadow, just shifted it all on the plate?
Mm-hmm. Okay, so then forward. Shooting. Oh, hold on. Alright, now shooting. Or is too spotty?
So the two spotty, they're also angled, so I don't need to pair them.
Okay.
And
So
then you're slightly missing part of the crown, so make sure your sensor is in there as far as you can.
okay.
Probably it's not helping because his head is really small.
Okay.
So that will help to straighten
Okay. Okay. Shooting.
Blood pressure is 95/56, not 72.
Okay, so you get the two center there. It's still too strong.
So
So, I'm trying to think because I think I through this again. So I would drop the back to get rid of the spot. And then make sure this direction that we're parallel to that sensor. If it's not. This one, this one. Okay, I can't quite tell. And I saw the
yeah, and
so I would put this,
okay,
so it's not the up and down. but
because the
it's
sensor.
Mhm.
Okay. Okay, shooting.
I would go swap down further. And maybe slide your sensor out a little bit. Because it looks like on the inside the edge of your tooth is going
Shooting.
So that's beautiful of the second and third, but you need to slide the center in the back of the mouth to get the finish. But your angles are all beautiful.
So set it back a little bit more. Shooting.
And we make the sensor cut more also.
So move this way.
And
Shooting. Did I even?
so,
I'm not doing the
so
full
you
route.
have this on the other x-ray?
Yeah.
So if you're gonna submit both this one and that one, you're good, otherwise
Okay.
you could slide it in to get the tips of those roots. Because sometimes with those big teeth you need two roots
Okay.
to get the whole tooth. So you just slide the center medium to get
Medium.
towards the center.
Okay. Try one more. Shooting.
That would be the roots.
Okay.
So those two views will be about. So now the only thing missing is that first two more.
So
You just
come
need to
forward.
slide it all the way to the center.
Towards the middle.
The nose.
The nose. Okay. And then move forward.
And then your teeth just inside the edge of that.
Okay. Shooting.
Beautiful. Now sometimes these canines get two views, sometimes you can get them in one.
Okay. Now, did you say you want an angle from this side or the other side?
Oh, no, but it's
This. Okay. Okay. Shooting.
So you got all of the crown, you're missing a little of the root.
Okay.
So your sensor is at this angle. If you tip it that way, that would gain that root.
Okay.
So you turn it a little bit of an angle towards the medium part of the mouth. And then I also will sometimes, because I've got the crown already, I might turn it and slide it in just a little bit.
Okay.
I might miss this, but I'm gonna have the that
full
view.
picture.
Yeah.
Okay. Shooting. I got it. Okay, so then for incisors. Let me know when you're ready. Shooting. Nope, I didn't. So I don't have that out far enough.
Correct.
Okay.
And you may be one that's hard to get all of them on one. So sometimes what you can do in fast is turn your sensor 90 degrees and then cross the front.
Okay.
So it might look at them, but his teeth might be too long. Actually. So now his teeth will be too long for that.
Okay. So do it this
So
way.
you just have to look and see these.
wait a second. Okay, foot traffic is clear.
Hold on.
Foot traffic clear. Shooting.
I'm just slide it over to get the other side.
Okay. Which way do I need to go more?
So this is his right tooth. So you need
Okay,
right
so
tooth.
more to the right. Okay.
Looks like he has a dead tooth. That one root canal.
In front. On that incisor. Let me know when you're ready, Abigail. Okay. Clear.
Yes, is he on everything?
He's on 3.
I'm gonna drop him to slightly smaller. Let's get this one. I wanted to take one more.
You want me to angle it more towards
So to
this
get
way?
into the squatty, you would drop this.
Yeah, that.
Actually, got them all in that too.
Okay. Shooting. Oh, it's just harder with it. Okay. Shooting. Okay. So now, do we need to click anything on there for the next slide or no?
No.
Okay, not yet. Wait till Abigail's done. Okay, we're ready. Shooting. Okay, so we got the front, but not the rear.
Right, do the same thing.
Move it back in a little bit.
Turn
Oh,
it
turn it.
sensor.
Okay.
I generally, for canines, would do my sensor at an angle.
Okay. So I'll just turn it. Shooting.
So all you need to do is move your sensor.
Oh.
You just shove it in further. You could change your angle, but
Okay. Shooting.
when you go back to the premolars or flatten your head out again.
Shooting.
So tell me what things you're doing to fix this.
Moving my sensor to normal yield,
Okay.
and then changing this angle a little bit more out. That'd be right, or would I just keep that angle?
No, I think that's good.
Okay.
Yeah.
Yeah.
What is
Two.
it?
So it's a 2 maybe
It's in
underneath. One.
Yes.
Okay.
Leave them with the two between the sensor and the
Okay. What if I can do better? Yeah. Okay. Okay. Waiting for Abigail. Shooting.
That extra tape.
Mm-mm.
Oh, just like
Oh, okay. Okay.
So
Are you okay with those views, or did you want more of a grip on the last
I do, but I think you can get it with the full camera.
one? Okay.
So you can shot. You see that you're two different angles?
Mm-hmm.
Get a good angle.
Okay.
So 90 and 6 on 2, blood pressure's 95/55, math of 69.
Okay. Shooting.
Too far in the
So come more.
It's not the actual sensor.
Just the sensor.
The
Okay.
sensor said
Too far in.
And make sure your line is just outside this. And that means your blouse to put your mouth open. So your sensor should be
There we go. Do you need more alcohol up here too, or no? Okay. Okay. We are shooting.
So your angle is really good there. You've got the break and the curve. You just need to slide it haughtily to get that crackle back here for the full camera. And it's really hard to do without stretching the mouth open.
I just saying.
Just saying.
Okay. Shooting. I mean, you'll.
So you went so far back that you went to the back too deep. You see your sensor is. You need to get your sensor here.
Okay.
And that's where the challenge is because the mouth closes right there. There you go. So get it back in there. It is what it is. No. Here.
Okay.
Make sure all the way there. And then make sure this angle and this angle is the same.
Okay. Okay. Shooting. So I don't make a root.
So that gets the whole crown, so now you can just go straight medially to get the root
With the,
with the sensor.
oh, the sensor.
The only thing you could do with your tube head needs to follow it, but you could shorten it and just get the root on, but then you just made your piece go in. So.
Okay. Shooting.
Just need to be slid in just a little bit.
Okay.
80 and 8 on 2. Blood pressure's 108 over 49. Math of 68.
Okay. Shooting. Okay. So now do I need to go back further for the other two teeth, or did I get them on that one?
So you were kind of missing their crowns a little bit.
Okay.
You did get their roots.
So just make sure to slide my sensor more out of the teeth.
So this is where I usually turn the sensor 90 degrees.
Oh yeah, okay.
And then I shadow from the back, so I turn my tube head in and out
This way.
the other way.
Okay. Or the
Same
other way.
action, but block all the way. There you go.
Okay. Okay. Shooting.
So, I'm gonna get this. So I'm gonna just turn it back on.
So just like this with the sensor.
Yep.
Okay. Shooting. Okay. So now we gotta do mandible.
Go ahead flip them on inside.
You want the beach tray?
I don't know, we'll find out and see what, what the features are. Just fill out are you starting in the back again?
Yes.
Which side are you starting?
Left side.
Oh, sure. Can you grab up the leaves and send one of the little non-objection
Waiting just a second for foot traffic. Oh, you're fine. We gotta wait till.
And that's probably why they said she was doing well. She was enjoying it.
Okay, foot traffic is clear. Is that
how you're taught to take this? I use parallel technique, so that's
Right.
how you're taught to do it, but otherwise I can show you
So-
a better way.
Yeah, go ahead.
So you get a better image because it's more like taking an x-ray and a regular x-ray. So what I do is I actually take this and put it down in the mouth and I look for these back two teeth, make sure it's as far back there as I can get it.
Okay.
And then I'll use my gauze or paper towel to kind of hold it. And then I literally just come
From the side.
straight in from
Okay.
the side as if you're taking an x-ray
Okay.
on a cat.
Okay.
Okay, you got it. And it's easier to take.
Yeah. Okay.
You can
So-
keep it together. The other will work.
Okay. Waiting for Abigail. Okay. Clear. Okay.
Okay. When I look at that view, I need to not shove it in foot so much, but shove it back a little bit. And sometimes it's really hard to get that edge, in which case I'll just turn this and shadow it forward a little bit.
Okay.
Not a lot,
Just a little bit. Okay.
But make sure your teeth are real.
Okay. Okay. Shading.
So did you pull the sensor out some?
I pushed it in more.
Or
It would
the
fall
direction?
out. Oh. Pull it out. Okay.
Yeah, because you need to go back to the back more. So these two teeth we're trying to get. So we need to get it here and here. So we need to get it past that crown. See that crown's and then part of it might be having a hard time keeping it from moving. And then you want to make sure that's
This
part of our
needs to be
problem. That is,
parallel, right?
yeah, that
Okay.
wasn't really parallel, so it was shining down.
Okay.
So you need to.
Okay.
That's
more.
why it's shooting it off your thing because it's not
Okay.
coming perpendicular.
Okay. Some more perpendicular. Okay.
Actually, that's
Okay. And shooting.
sweet.
Okay.
Beautiful shot. Now you can do the same thing going back to the next two. One thing I will tell you is people tend to let the sensor angle and you miss one of those roots in that first moment. So you want to make sure when you do it, you're keeping the sensor straight this way
Okay.
and just going straight down
Down.
as far
Okay.
as you can. Because you can feel it here, that way you know you've got more of it.
Okay.
And you're going to have to draw it over there.
Oh.
On
Shooting.
the jaw, man. Still on the jaw. Sweet. So, what are you missing in that? You could call the entire tooth, that first molar. Are you missing any part of that tooth?
The other root. On this side. Or that
Yeah,
one?
that's the rostral root.
Okay.
You're just missing the tip. You need to shove that slide down into the mouth a little bit more.
Down that way. Or this way.
Shove the front part of the sensor more over here. If you can't get it more, then you need to pull that up some.
Okay. And then shove this way. Which molar is it?
So it's this tooth.
Oh, okay.
And you're wanting the tip of that. You need to shove that in up here. And if you can't, then you need to shadow the tooth and you can angle it up. You always want a little bone around the root.
No. Shooting.
Patiently wait.
Yeah, you're fine. Patient first.
There you go. So, for the other ones, you can sometimes get the first one with that same view, but as you'll notice, his mouth is narrowing, so you don't have as much room. So, usually you have to go at an angle, and that's probably going to get you all of that tooth and part of that tooth, but you're going to miss that. So, depending on the dog, I'll do that, and then I'll do the shot you were going to do to get the rest.
Okay.
Or you can just aim for this, but sometimes I find you lose that last root. So I always like to secure that tooth first. And
Okay. Okay. Ready for shooting? Open. Okay. Shooting.
Okay. So just like I said, you got all the first one, most of the next one, and a little bit of the other one. So now you're gonna do your 45. So what we were trying to do from the start. You have to flip your sensor 90.
This way or this way?
Just flat, flip them out. Yep.
Oh, okay.
And the things you want to make sure is it's far enough forward and that your teeth are within that right one.
pressure is 86/48, math of 61. Want me to go up to 2.5? Because our respiration increased.
She's done that one time. Because the numbers are coming in a good spot. We're all too high.
Shooting.
So, imagine your sensor, the edge of your sensor's here. It needs to be here. So you need to shove it more manually. Otherwise, your angle looks beautiful.
Okay. And shooting. Cool.
So that was really long. You need to shorten your tube head. Also,
So like this?
yeah, also will be look at your, I don't know why it seems, oh, I think it's because this is not at the same angle as that. So
Okay.
you need to,
Okay.
you need to make sure you're always matching angles that way, or it shines in front.
Okay. This
So
one.
it's too tall. I gotta think about it because it's not in the position I'm used to.
Right.
Usually I would like, so I gotta go, I
Down.
should go, shorten. But that seems like a lot. Yeah.
Seems fine. Okay. And shooting.
So they're slightly squatted, so if you want a better picture, go just
A little bit more
Mhm.
butt down. Okay.
Like that, where you want it.
Okay. Shooting.
Shoot you all. Said I was gonna shoot you all.
That was a little bit not much.
You can go for
Do you want the canine now, or you want more of the? You want me to try and butt down more?
depends how perfect of a picture you want. It's
That's
just
what you
small.
want.
Chop it on one.
Okay.
It also shows you how much movement you need to make a difference.
Alright. Shooting. Okay, so then we're gonna angle this that way. Sorry. Trying to get him. This way? Or would you want
We
it
haven't
more
done the
this
other
way?
canine yet. Oh wait, that's the switch, sorry. You are good, yes, that's good.
Okay.
Who?
Paychecks. Money.
Can you push the button? Or you can push it out. Oh, no. So, you just put it there. Where? Oh.
Sorry, I gotta reposition. Sensor.
Hi, thanks for holding your standing forward. All right, I'm in the middle of the dental, so if you can make it quick.
Shooting. all the way.
Let me put you on hold real quick. I gotta get this
Okay. And then Abigail. Shooting. I think I missed that one completely now that I see it from here. Oh, I think a root. Okay. Yeah. I'm shooting. Oh, I got the roots.
Sweet.
Just gotta get the crowns part.
That's my favorite shot, to get the canine roots.
Right, I know,
Because you
right?
have those
They're
on-
already both on there.
On smaller dogs or cats, like that's my favorite thing.
Okay. And then I'm gonna try and get the
And then
crowns of the incisors.
You're gonna want this white line is
Yeah.
what the sensor picks up. So to get the crowns, you're gonna
Make
want
sure
to
to pull it out
back,
more. Oh, okay.
because anything past. Do you see the white line?
Yeah. Oh, that
So-
one. Okay.
Yep,
I
that
wasn't
white
that-
line. This
Okay.
isn't picking up anything.
Okay.
This is. So you'll want it out just a little bit more.
Okay. Thank you. Okay. And shooting. Okay. So those are crowns of these. Right. Those are too small.
It might be just a little squatty, so you'll want it parallel. So just straight up, because this is straight down. Perfect.
Okay.
Beautiful.
Oh, you're fine. Okay. And shooting.
Beautiful.
Okay.
Do you have anything on this?
So now we're gonna move to the right side.
Right side.
Let's do that.
So we'll have to click.
Yep. It'll be opposite of what you think.
Right there. Or this.
I think it's.
Oh yes, that's right.
Yeah. I was like, if you hover in just the right spot, it will tell you.
Right.
But finding that right spot is near
Okay.
impossible.
And then I already got the root with that, so.
Okay, thanks.
Should be on the premolars.
Okay, this one she said it could do flatter
Mm-hmm.
and do this way.
So just tiniest bit that way, because of that white line down the side again.
Okay.
And then you still need to go just a little bit more.
Back.
No, you're good. Let's
Okay,
see what we
let's
got
see what
there.
it looks. Okay, shoot.
Hopefully over move it. A little squatty, so
More up.
yep.
Okay. More.
I'm like, no, I'm thinking.
No.
This is my thought process. Sorry.
No, you're fine. Okay.
Down if they're squatty.
Yeah, that's what I was thinking.
I went
Why, but they're
backwards.
also angled. Those are some cool roots. So make
Oh.
sure your sensor this way. So come look over here. No. See how this is sort of wedging?
Yeah.
So you want to turn this way. So they're coming more at a straight angle.
Okay. That looks
So
okay.
we're doing something.
Okay. Hold on just a second.
Map is-
Okay, shooting.
So those are super squatty.
So we want to come out this way?
Yep.
Okay.
Which is going to be the opposite of what she used to do.
It's because I'm
Or backwards.
in this recumbency. Okay, is that she might shape limits?
You might do a tiny bit more, but I probably don't. So that kind of things to.
Okay, we'll try that.
I'm gonna-
Let's see.
I wanted to make sure these.
And shitty. Oh, those are better. Better than the last one, that's for sure. How are we doing?
We're doing pretty good.
Okay. So no
I
funny
just wanted to check.
is
That's much better.
eyes are rolled down.
They're
so
still a
you're
little
good.
squatty,
But much better than ones.
Mhm.
Map is reading
Do you see the
58.
crazy roots here?
Okay. Yeah.
So let's put that one in that way.
Do you want me to go ahead? We're on 2. Do you want me to go ahead and turn down to 1.5? Map is 58. Everything else is staying.
I would double check it because your CO2 is dropping. Suggested.
That was after I had already checked it. So it was reading 52nd.
Can you do 1.75?
Turning it down 1 3/4.
Perfect.
Okay, so I got this one and this one, right? Already?
Yeah, 3.
Okay, so then I just need to get back here and we're gonna do that. And then
Yeah,
this
so you
way.
need the 4th one. Sorry, I wasn't.
Okay, so this
So
one.
yeah, you need this one.
Okay.
And
Now we'll do-
because you're gonna do it that, you want to you want this sensor to really get down here.
Like,
So I would actually
turn it. Okay.
would literally just aim
Okay.
that way.
Says jaw tone pretty close.
Yeah.
Might keep a close eye because we kind of increased respiratory.
So maybe starting to wake up a
Maybe
little bit.
he's
Okay.
in a weird place, so.
I think he's gonna wake up early.
So go ahead and put it back to 2.
Okay. Please.
2 1/4. Okay.
Can you feel the pulse?
Yep. Yeah, and it's strong.
And you might have to run that when you wrap it.
Okay.
I don't know if it makes a difference, but I always do the 2 away from the cat mark.
Maybe. You can always try. I might retouch this on too.
No, you're fine. I just wanted to make sure.
No, you're good. We're not back here
I can
commenting.
Okay, we'll go ahead and take a shot. Shitty.
Cream on that. Beautiful.
So you
So now we're
know.
moving back.
What do they do when you're throwing it on? I mean, that's natural. It's probably the one for the 100 head. But
That makes sense.
I don't know if that's right.
No, you're fine.
Maybe.
Okay. Shitty.
Is that your left side?
Yeah.
Okay. So because that tooth is so much wider, you want to turn your sensor.
Go ahead and turn it the other way again. Okay.
Yeah.
You're all set.
That definitely.
Push the buttons and look for it.
Waiting. shooting. Oh my. Okay. So.
My turn looks 2.5 out again.
2.5.
Thank you.
Yep.
And maybe give me a deep breath.
You just push here.
Yeah.
Yep, and then. Okay. And shooting. Okay, so do I need to go? I need to go further back, or do you need more of the crown?
You actually got the crown on another X-ray.
Okay, that's what I thought. And so I need to
So,
go
yeah,
further back.
back.
Okay. And shooting.
It could be nice and easy.
Okay. What do I need to adjust?
Okay, so your sensor is too far in that way, but
Needs to come.
so you want to make sure you almost have to get in there and at least you can find where those teeny tiny teeth are.
Oh,
So you want to make sure you're up here. See, it says it goes that, and it's
Yeah.
going to cut off your tooth. So you need to
Okay.
get something wedged in there to kind of hold that down.
wedge.
Yeah.
This way?
Mm-hmm. Kind of this way. Yep.
Okay.
Can't see my sensor anymore. Yes, that looks like that's got
Swallow
it.
it.
Okay.
And then
And
that's
then,
I'm starting to swallow.
go through. We need
Need more
ISO.
ISO.
So yeah, but I wouldn't have it angled as far back like that.
Okay, just shallow it.
Okay.
Okay. And shooting. There he is.
Yeah.
Okay.
I don't know if we have the tiny. We don't have. We're missing this.
That part? Okay. So then more down, like that way?
I would just shove the sensor in less.
Okay.
Or maybe angle it up a little bit because you want to
Okay.
shadow it towards the center. Because it's just missing it.
Okay. Shooting. Okay.
Perfect.
Yeah,
Okay.
you turn it
So
off.
yeah, you turn it. Otherwise, it'll get.
It'll bubble out.
Going down.
Okay. And you can go ahead and turn that off. Thank you.